Yeah, so essentially, in the study, we had 56 patients treated with consolidation Durvalumab, 33 that were treated with consolidation Osimertinib, and 47 that were treated with observation alone. And again, all patients were stage 3 EGFR-mutant unresectable non-small cell lung cancer. The first takeaway was that looking at the primary endpoints, number one was progression-free survival. We showed that patients treated with consolidation Osimertinib had a significantly longer progression-free survival compared to consolidation Durvalumab or observation. In fact, the median PFS was not reached in the Osimertinib treated group versus 12.7 months in the Durvalumab treated group and 9.7 months in the observation group. There was no difference in the PFS between the Durvalumab consolidation group and the observation group, as previously shown in other studies. There was no difference in terms of overall survival across the three groups, although I would like to note here that the follow-up was limited, especially in the Osimertinib treated group. The third takeaway is that the treatment-related adverse events were similar between the Osimertinib treated group and the Durvalumab treated group. Around 50% of patients developed treatment-related adverse events in both groups. And the rates of pneumonitis were numerically lower in the patients treated with consolidation Osimertinib compared to Durvalumab, although there was no significant difference. But essentially, there were no unanticipated safety signals when patients were treated with consolidation Osimertinib, showing that this is a safe treatment regimen in this setting. Finally, we saw that patients who were treated actually with EGFR TKIs after they had received Durvalumab consolidation had higher than expected rates of pneumonitis and diarrhea. And actually, they had around 14% of patients develop pneumonitis and 14% develop diarrhea. And this is higher than what we typically expect. So overall, I would say that this study suggests that among patients with stage 3 unresectable non-small cell lung cancer with EGFR mutations, consolidation Osimertinib is associated with a significantly longer progression-free survival compared to Durvalumab or observation, and there were no unanticipated safety signals. However, we still need longer follow-up to look at the overall survival data, and we await further results from prospective studies such as the LAURA trial.